Hi. So today I'm going to talk about a topic which is very common in the field of sports injuries. So the injury which is very common ligament is the ACL ligament. So the ACL ligament is a ligament which is inside the knee joint, and it is very commonly injured or torn due to any of these sports. And it can happen even with any road traffic accident, or even if you have a small fall at home also, this ligament tears. So what are the common symptoms which you will see after a fall or any sports injury? You will commonly have a problem which is the swelling. The first will be the swelling on your knee joint. Second will be when you walk, you will have instability issues with which you will feel like when you're walking, your knee will shake. So this is called as an instability issue. So post an ACL tear, this is a very common symptom which you will see following a tear. If you have these symptoms, then immediately you need to consult a doctor, because if you don't take care of these instability issues, what happens is the ACL ligament can lead to a multi-ligament injuries. Because in a L knee joint, we have 4 ligaments, which are the 2 ligaments, which are called the cruciate ligaments, and 2 shock absorbing ligaments, which are for the meniscus. So when an ACL ligament is torn, and if you don't take care of it or don't give a proper treatment, then it leads to a meniscal tear, which is very common. So that's why always when you have a symptom which is specifically giving you a symptom of instability issues, you always need to consult a doctor immediately. Take a scan, which is MRI scan, to confirm the diagnosis. If you have an ACL tear, so an ACL tear, there can be a partial tear or a complete tear. So in case if you have a partial tear, then the first line of treatment would be proper rehab. You need to go with a strength and conditioning program, which should be the strengthening of your quads and hamstring muscles. So which you have to do at least for 2 to 3 months of time if it's a partial tear. But if you have a complete tear with the symptoms of instability, as I said, like the knee is shaking when you're walking, this kind of a symptom will require surgery, which is an arthroscopic keyhole surgery. So now the latest advance is doing this ligament reconstruction with a keyhole surgery by putting 2 keyholes in your knee, and we take a graft from your inner side of the thigh, and this is called as a hamstring graft, and we reconstruct the ACL ligament with a button and a screw in the tibia bone. So following this reconstruction, the main important part over here is the rehab part, because surgery plays a very minimal role, whereas the post-op rehab plays a very bigger part. The rehab here plays into 3 different stages. So we split it into 0 to 3 months, which is the basic strengthening program. The second 3 months is the strength and conditioning program, and the last 3 months will be the agility and endurance program. So once you go through this entire program, which is of a duration of 8 to 9 months of time, and then only it's better to get back into the competitive level sports. So this will help you to get into your proper training and help you in preventing any of the sports injuries also in future later date. Thank you.